Well, we all have an interest in the effects of exercise on the immune system, and in particular why athletes get more infections. So that's one reason, but we also teach the subject to our undergraduate students, and we also actually have a full module of exercise immunology that we teach to our master's students. So we thought really a textbook on that particular topic would be very good for our students and help them with the subject matter. Well, it's about the effects of exercise on the immune system, the cells that defend our body against bacteria and viruses that cause infections. It's also to do with the causes of inflammation. So there's interest in the effects of exercise as to why it helps reduce the risk of chronic disease, and it does that partly through reducing inflammation. It also makes doing too much of it can also make you a little bit more susceptible to picking up infections. So it's all about the reasons and the mechanisms for that. That's a difficult one because there's always new stuff going on, but I think probably the most important things nowadays are that people are starting to look at the effect of exercise on gene expression in white blood cells, and this is throwing new light on some of the things about exercise and inflammation in particular. There's also interest in various nutritional interventions and food supplements that might help to boost immunity in athletes and reduce their risk of picking up infections. Okay, well, the two sort of main things they can do is one to sort of reduce their risk of being exposed to pathogens, and secondly to try and maintain a robust immune system. In order to reduce exposure to pathogens, you're talking about things like good personal hygiene, washing hands regularly, brushing teeth regularly, not sharing personal items like cutlery, towels, sports bottles, etc. Generally avoiding sick people and children who carry lots of germs and then pass those on to you. And avoiding contact with everyday objects that lots of other people are touching, like door handles and the like. It's really common sense in many ways about trying to reduce your exposure to bugs in the environment. And then to maintain a robust immune system, it means managing your training, not doing too long, too hard training sessions which can depress immunity, making sure you get adequate sleep, ideally 7 or 8 hours of sleep a night minimum, and ensuring that you're eating right and that your energy intake is matching your energy expenditure, you're having enough carbohydrate and protein in your diet, and that you're not going to be deficient in any of the essential micronutrients. And some of these, it seems, it's not always the case for athletes that they eat the best, and even many athletes who eat well can still be deficient, for example, in vitamin D and sometimes in iron, and so they need to pay special attention to these because those are the things can actually really have a negative impact on your immune system if you're not getting enough in your diet, or for vitamin D, in that case it's getting enough sunlight.